Okay. So just to let you know that the reason we're recording this meeting is that we're going to send it to you afterwards, so that if you have information that you'd like to rewatch and make sure that you understand, then it's going to be available to you all the time, as well as resources that we will put together, some top 10 resources available online that will help you to reinforce, especially the information that I'll be giving you today. So let's go back. My name is Magda, and I'm a labor and delivery nurse. And then I've also become a lactation consultant in the last 5 years. And so with this knowledge and experience, I've really become focused on ensuring that parents really know how to prepare for those early days and hours even after your baby's born, because we don't know how it's going to go, and we need to know that you are ready for whatever happens. Especially in order to succeed at breastfeeding, you kind of have to know how it happens in those first few days. It can be a really exhilarating time and really emotional, but exhausting as well. So you need to know that it's going to be okay, especially if you know what to do. So let's look at who is this presentation for. Really, anybody who is expecting a baby, anybody who has had problems in the past. Even if it's not your first baby, that's okay. If you've had problems and you'd like to know how to take a charge of your situation and probably get a much better start. A lot of problems can be fixed if we look at those first few hours and days that we can get started. Because breastfeeding is beautiful, it's fulfilling, but it's not always easy. But instead of waiting to see how it goes, it's really good that you're here and you can help focus your plans on not just the birth, but the immediate time afterwards, where you and your baby are going to learn how to be more confident, both of you, in learning and breastfeeding. So what can you do? So we just want to reinforce the fact that, especially during a pandemic, breastfeeding and human milk remain the most important immunological and defense and nutritional foundations available for a human infant. And this is a really nice graphic I found just to show you the differences between human milk on the left and formula milk, which is nutritionally complete to be able to support a baby, but there's a lot of live bioactive ingredients that are only capable of being produced by a human body, can't be reproduced in a lab or a pharmaceutical manufacturer. So keeping in mind that as many drops or as much milk that you can give your baby, that will help to protect them a little bit more. So I'm just going to start to tell you that breastfeeding is really without rules. A lot of parents I see in the hospital want to know what the exact recipe is for delivering, for ensuring that you breastfeed. And it's not possible to give you a recipe. But what we want to know is there's going to be 3 principles that I'm going to share with you that will get you through those first few days and that are important so that both of you learn how to breastfeed and avoid common problems that can lead to supplementation with formula. And especially these 2 problems of excessive weight loss and jaundice. So I will talk to you about how to be prepared, but also how to have realistic expectations of what's coming. So the 3 basics that I want to talk about are having your baby skin to skin and prolonged skin to skin contact. And I'll explain a little bit more about what that is. Ensuring that your baby is getting enough, because that's a big preoccupation for many parents. They don't know, they can't see volumes. So we need to know that your baby is getting enough food. And then at the same time, we want to make sure that your production is there, because sometimes the two don't necessarily go together. If your baby is getting enough, yes, we're going to know that the milk is coming in. But at the same time, if your baby is not necessarily feeding at the breast, we can help to fix that. So let's see how we can start. So skin to skin contact has been very scientifically proven to be the best neurobiological start for a human baby. And holding them close to you and in full contact of your body helps them to feel reassured, helps them to feel safe. Listening to a parent's or a caregiver's heartbeat makes them feel that they're safe because that's their environment, that's where they came from. It also has the benefit of promoting good attachment, especially in the early hours. It helps to keep the baby calmer. It helps to stabilize their temperature. It helps to stabilize their heartbeat, their blood sugar as well. So it gives you a lot more confidence because you can respond to your baby much more effectively when they're that close to you. So let's look at when you should do this. So as soon as possible after birth. Sometimes that may be a bit delayed, but as soon as you can, right after your baby's born. If an hour is possible, that's minimal. If more is possible, then keep your baby on you. If you're delivering in a hospital and you're being transferred from the delivery room to a postpartum room, keep your baby skin to skin because the longer they stay there, the more responsive and interactive they can be with you. We really want to try to avoid wrapping the baby too tightly because what it can do is actually prevent them from showing you their feeding cues, which we'll talk about later, but also they can become overheated. And we know that babies don't do well when they're overheated. They don't feed, they sleep, they become more sleepy. And so it's better to have your baby exposed to the air and just close to your body to keep them warm as opposed to wrapping them in blankets. So babies were meant to be close to our bodies after birth. We want to talk about what is safe because a lot of times skin to skin contact can be done poorly. So I'm just going to show you, I'll pause my presentation for a second and I will show you exactly what position we want to make sure your baby's in. So we want your baby to be really naked. So a diaper, and I'm not going to take my clothes off, but I'd like you to have no t-shirt, no bra. And your baby should be upright between your breasts with two hands up and their little feet turned up and curled up. And the reason we want them front to front is because that's where they're going to be exposed to the most heat. Your body will heat up to respond to their need if they're a little bit colder. So that's a really important part. Cover them with a little blanket, and that's all you need to do. And then make sure that you're a little bit upright, not completely flat. And you should be able to kiss their head. So their head should be kissable. And their head is turned to the side. You can see their faces just enough to be able to see that they're breathing clearly. You can feel their breathing through your hands. Their nose and mouth should not be covered. So a blanket should just go over the body, not over the head. The neck is straight because now they need their airway to breathe properly. So all this really helps to keep them responsive to their cues. Sorry about that. So let's look at what we can do to make sure that this helps with feeding. So let me just share the screen again with you. Let me just silence my phone because it's going to interrupt us. No, it's okay. It's just it's Carmen asking about haircuts. Okay, so How do we then get started to make sure that your baby is going to be feeding and being able to be getting enough milk in those first few days? All babies have very, very important reflexive behaviors that they're born with, they're programmed with to ensure that they can feed. So it's a universal language. All babies across the world will be born with all these reflexes. Now, some of them may get a little bit interrupted because of the birth process. Sometimes it's difficult to get them to respond right away, but there's stuff that we can do. We'll look at how to latch. The cues that you're looking for are your baby putting its hands to the mouth. It's turning its head and looking for food. Whenever you touch their cheek, they're going to turn towards it. That's called a rooting reflex. They're going to open their mouths. They're going to lick their lips. They're going to suck on their lips or on their hands. So we don't want them to get to the point where they're crying. Crying is really a late cue, and a baby is really difficult for them to focus on feeding when they're frantic because they feel distress. They feel somehow that it's not safe. They don't know what hunger is. They just know something is wrong. And so we need to know that they're born with lots of resources. They don't need to be fed immediately after birth. They can take their time and get ready. So how do we help to make sure we can get our babies latched on properly? So regardless of the position, oh, if you don't mind, please, whoever joined us later, to mute your phones, to mute your microphones. Whenever your baby is latching, it doesn't matter what position they're in. There's some very basic kind of principles or position of the head and the body that's important in order for them to be able to get a good latch. Why is a latch so important? Well, a poor latch can lead to a baby removing less milk from the breast, which can then lead them to get jaundice, have a big weight loss, and so also lead to nipple pain or damage, which are all those reasons, all those situations are often reasons why supplementation happens with formula in the first weeks of life. So it's important to know that they are, first of all, human babies are abdominal feeders. So that means that they need to be front to front with mommy. So it doesn't matter what position your body is in, it should be, even if your baby is in a position of across the chest, they should be tummy to tummy with you. And that also leads to the next step, is that their bodies need to be in a straight line with their ears, their shoulders, and their hips all aligned, because that helps them to be able to swallow more easily. When I have my coffee, I don't have my head turned to the side. My head is straight and sometimes even tipped back. And that's the other thing. Babies need to be able to move their head back to be able to get a good wide open mouth. So when we hold their heads, we prevent them from moving, and sometimes babies will struggle because they're feeling like they're being forced to do something that's not natural to them. So when you hold your baby, in no matter what position you're in, hold them around the base of the neck like this and support their bodies with your forearm. And whether it's across your body, whether it's along your body, whether it's beside your body, these are all positions that are very helpful. However, the body needs to be in a straight line and they need to be able to move their head back. So what can you do to ensure them to have a deeper latch? So make sure you're comfortable. It never is a good idea to tip your body over to try to bring the breast to their mouth. We want to bring the baby to the breast. I always say, this is attached. Well, this one isn't, but these are attached. The baby's not attached, so we can move them to where the best place is. The next thing is we want to support your body. So we don't want your shoulders to be up here. We want you to be able to place the baby on a pillow and something that will support its weight of its body. Then we bring the baby close, like I said, tummy to tummy. And I'm going to just make the screen bigger so that you can see me bringing the baby in. So I'll turn off the share for a second.
I cannot hear you. Is it me?
No, okay, there we go. Sorry about that. So we really want them to be tummy to tummy with you and with their body positioned in a straight line, but the head extended a little bit. They should line up their nose to the nipple. The reason is that when they open wide, we want them to grasp a large part of the areola, the dark part of the breast, in their mouth with their lower jaws. If they place the breast into their mouth like this, straight in, they're going to squish the nipple with their tongues against the hard palate of their mouth. So they're going to cause you pain and it's going to cause damage. On top of which, not a lot of milk will come out. Once they have a nice big mouthful of breast, the jaw and the tongue are working to bring the milk out. They're massaging down here. They're massaging down here. So it's important for them to be able to have that large amount of breast up here. The upper lip will just be essentially closing to make a seal onto the mouth, onto the breast, like a little suction cup. And then they draw the nipple into their mouth to make it deeper and more into the soft roof of your mouth, of their mouth, so they're not squishing and causing you pain. If you're having trouble with the baby not being able to come in close, make sure there's no clothing or blankets between you. And if you find that their head is not extended enough, then press between your shoulder blades to be in between their shoulder blades to bring their bodies closer to you, because that's what will cause them to extend their heads a little bit more, bring the chin in closer, and allow them to get a little bit more deeply latched. Okay, so in the end, we want their bodies, their breasts, the face to be really close to the breast. The chin and the lower lip should be not even visible, okay? And then the nose will be fairly clear because their chin is more closely buried in the breast. So that's what we want, especially if you need to help them. Sometimes babies will be able to latch themselves. So as long as their bodies are close to your body, sometimes you'll be amazed when a baby is first born, and even for the first few weeks after birth, when placed on mom or dad's body, tummy to tummy, often they can make their way to the breast by themselves and latch on their own. So because of that stimulation, tummy to tummy, it's going to help them to use their own reflexes to feed. So it's important to trust that they know what to do. They have very strong instincts to do these things, but we're the ones who have to be more willing to let them do the work and supporting them as needed, and not necessarily doing it all for them all the time, because they are the ones who need to open wide, grasp a large piece of breast tissue in their mouth, and then start to suckle. So then what happens if my baby is not able to latch? Or what happens in the first 24 hours is sometimes they're too sleepy. They're recovering from birth and they just don't have it in them to really get a good feeding. So what can you do? Well, the hormones of delivery really make it a lot easier to extract your milk, and especially in the first hour after delivery. If your baby latches well and is able to drink effectively at the breast, then that's going to be really great for your production. But if the baby is not able to latch comfortably, that could mean a decreased production later on. So using that first few hours after birth, especially if you're separated from your baby, as well as if they can't latch, to use your hands to remove the milk from your breast, just like your baby would do if they were able to latch. So that first few hours of milk removal, whether by yourself or by your baby or both, will help to make more milk in the weeks to come. And it's really, you're placing an order for milk production later on. So it's a very crucial, and if nothing else, I want you to remember about this, because sometimes those first few hours after birth, especially if it's been a long, painful process, if it's been very exhausting, you're just glad it's over. But I want you to know that in order to be able to have breastfeeding be successful, you want to keep on working at the production. So you can also start to express your milk in the days before your delivery, unless you have a high risk delivery, a cesarean planned, then it's not a good idea. But if you're just waiting for your baby to be born, expect it to be natural, you can start to practice this process. So how does it work? First of all, we want to make sure it's painless. So first of all, wash your hands well. Have a clean container of some sort. In the first few days, and we'll talk about milk production in a moment, in the first few days, there's not going to be a lot. So sometimes a spoon or a tiny little cup works really well. Later on, we can use a clean container to catch the milk that's going to be expressed. You start by massaging your breast. And I'm going to stop the share again so you can see me a little bit more. Massaging the breast all around to start to warm it up. You can roll it between your hands. You can rub the whole breast and the nipple in order to stimulate essentially what your baby would be doing and get that the milk hormones flowing. Then we hold the breast with one hand, placing the fingers really evenly on either side of the nipple, and in a very gentle but smooth motion, press backwards towards the chest, and then squeeze your fingers together and hold it for 1 or 2 seconds. Press again, squeeze, release. Push towards the back, squeeze, release. And in the few hours after birth, you may see quite a bit of milk coming out. If you wait too long, it's going to be a little bit harder for the milk to come out because it is thick, it is sticky, and we need to work at it. So if you've had to wait to express your milk, keep trying. Don't give up on it because it's there. It's been there since the middle of your pregnancy. So partners are really actually excellent at doing this. So have your partner practice. If you're very tired, start to practice to see how it works. For every mom, it is a different placement. So don't be shy to move your way. Keep on massaging gently and waiting for those colostrum drops to start coming. Then repositioning your fingers around another position on the breast. So meaning start, for example, at 12 and 6 on the clock. Next, position your fingers at 3 and 9 and sort of work your way around to make sure all the deep glands are being massaged. So if we look at milk production, you'll understand why it's so important to keep that milk, that flow going, but also how to push back in the breast to massage that breast. If you can see the breast on the picture, there's a lot of glands deep inside, and all those glands have early milk, or otherwise known as colostrum, in them. So we really want you to push back and massage those glands so that milk is removed. Now, we have a supply and demand. What does that mean? That means the more milk is removed from the breasts, the more they will be refilled. And that goes right from the beginning. And that is often why a baby tends to feed very frequently in the first few days, because they are helping your breasts produce enough milk for them. So if your baby is not latching well, or you're having pain, the best thing you can do is just keep on removing your milk with your hand, and that will also help to feed your baby. So the colostrum in the breast here on really is there when you give birth. So it's already been there since as I said, early labor, early pregnancy, mid pregnancy. And it's okay if you don't have any leaking. It's okay if you don't get out very many drops. Your baby needs very, very little. And we'll talk about amounts in a moment. As more milk is removed, as more stimulation and more milk is removed from after the birth, the milk starts to change from thick, sticky colostrum, which has huge protective and protective qualities. And it's all the baby needs until the bigger volume of milk comes in. So you can see that as the days go on, the milk volume becomes bigger and the color changes. So these are all things that are going to tell you that your quote unquote milk is coming in. And that's not when you start to feed your baby. You start to feed them early on so that they can get that colostrum, because the colostrum is so huge that it has germ fighting cells. It promotes stomach function. It helps to prepare the intestines to be able to digest food, and also has a laxative effect, so that some of that black tarry meconium that you can see a picture of here on the lower left side, that is what your baby will be pooping out in the first few days after birth. But as you can see, over the next few days, as your baby starts to digest whatever milk they're able to get out, they will start to change the color of their poops to more yellow, more green, and then yellow after day 3 or after day 4. So it's important to know that it's a progression. It's not an all or nothing. You won't have, your breasts are made to make just little bits of colostrum because your baby's tummy is really, really small. So it's really normal to feel unsure, since you're not seeing volumes going in, to know, am I giving my baby enough? It's usually very much enough, especially if your baby is able to remove the milk. So how do you know? First of all, in your Tiny Talk to Toddler book, you'll find this fact sheet, which shows you exactly what we expect. What goes in must come out. So the first day of life, we're only going to have 1 wet diaper and 2 to 3, 1 or 2 black tarry meconium stools. Then after day 3, we start to see more green color, and the number of wet diapers will increase each day. And so you just keep track of those and make sure that there is enough wet diapers, that the stool is changing color. And those are really important to follow in those first few days. And that tells you that your baby is getting enough. So any time that your baby looks interested in feeding, feed them. There is no such thing as scheduling feeds. And I'll get back to you about that in a second. Now, if your baby's not interested in feeding, what can we do? We express milk and give it to them by spoon. Sometimes they're sleepy because of deliveries. Sometimes they're sleepy because they've had some medication, or you've had medication during labor that can make them a little sleepier. That's okay. As long as you're removing your milk with your hands, giving it to them, they will have enough. And sometimes it's really worrisome because it doesn't seem like very much. It's meant to be drops. Nature has prepared your body to give your baby enough. And milk production issues usually start being problematic only after the first few weeks, because that's when your milk is starting to be produced in the volumes that your baby needs. The first week, you're not expecting a huge amount of milk. That thick yellow colostrum that you get out, the drops, will be plenty. So you don't want your baby sleeping longer than 3 hours. But if your baby feeds more frequently, it's not because you don't have enough. It's because your baby is instinctively helping to have your body produce more milk. It's a very much a communication between your baby and your body to be able to support your baby, just like it's doing through your pregnancy. So continue to trust your baby and the process of the milk coming in. The milk is already there. It's the early milk that's there, and the more mature milk comes in, but it's all milk. It's all good for your babies. Now, it's normal for for all babies born um, to have a certain amount of weight that they're going to lose. And that will be followed by the hospital. That'll be followed by your CLSC nurse who'll come to visit you afterwards. It's not worthwhile buying a scale to follow these things. It's really important that it's interpreted, weights are interpreted by a little bit more of an experienced person, because we need to ensure that that baby is really feeding well. So it's very difficult to just weigh a baby and say they're getting enough. So after 3 days, we expect that the baby's weight will start climbing, and it's a very slow climb. By 2 weeks of life is when, on average, we expect your baby to regain its birth weight. So it's a slow progression, and those first 2 weeks are very crucial in developing enough milk for your baby. Now, how do you know your baby's had enough milk? So we need to look at baby's hunger signs. So if your baby is feeding on your breast, look for signs that your baby is swallowing. This is very, very important. There is going to be a certain pattern of feeding that your baby will show if they're swallowing milk. Now, because the volume is not very big in the first 2 to 3 days, it will not be necessarily that they will swallow every time they suckle. So what I mean by suckling is the jaw, the mouth is moving in this kind of pattern that looks like they may be drinking. That is not necessarily the case. What needs to happen is you need to see your baby's jaw drop just a fraction of a second longer in order to be able to say that milk is going through into their tummy. Because if they're not swallowing, then they're not getting milk. They need to be able to get that milk not just out of the breast, but also into their tummy. So they need to swallow it. So if in the first few days you see a lot of suckles and only a couple of swallows, that's enough. But as the milk becomes more volume and you feel your breasts getting fuller, you'll see more frequent swallowing happening with each feeding. So keep an eye. And also keep an ear, I pointed to my ear, sorry. Keep an eye out for those drops in the chin, but also keep an ear out for what's a very subtle, sometimes cough sound as they swallow. So it's very, very important to pay attention and closely. Now, your baby will be satisfied if they've drank enough. They will come off the breast sometimes spontaneously. They will have relaxed, floppy hands. So when a baby is hungry, their hands are often curled up against their body and often in their mouth. So when they're feeding and they're getting milk, their hands are slowly starting to get more and more relaxed. And when they're full and they're satisfied, their hands will be like I call spaghetti hands, because they'll really be floppy and relaxed. There's no rule about feeding on both sides of the breasts. One side, both sides. It depends when your baby's had enough. So a good start is if you're feeding on one side and then your baby seems to have fallen asleep, take them off, put them on your chest, have them burp, try to burp them. They don't always need to burp, but try to burp them. This will also stimulate more feeding cues if they haven't had enough. And then feed them on the other side if they'll take it. If they don't, then make sure to remove the milk from that side with your hands in the first week of life to be able to ensure that both sides get stimulation. So that stimulation and that milk removal, again, is what's going to produce or stimulate more milk production. If your baby falls asleep, you may need to stimulate them at the breast. So sometimes tickling their back, tickling their little feet, rubbing their head or rubbing their cheeks will also stimulate them to start feeding. If they don't seem to respond to that, doing what's called a breast compression during the feeding is also really helpful. Now, when we looked at latching the baby, we also wanted to make sure our fingers were nowhere near the brown, the areola, because we want our hands to be always near the deep glands of the breast. And with feeding, your baby is well latched. We don't want to interfere in that latch, but we want our hands to go around a deep part of the breast and just squeeze it out for about 2 to 5 seconds. So you just count 5, 4, 3, 2, 1, and release. And then do it again. And often you'll see if your baby has stopped suckling because they weren't getting enough milk, this will give them a little bit of an extra shot and say, oh yeah, this is what I'm supposed to be doing here. I'm supposed to be eating. So this all helps you to make sure that your baby drinks enough during your feeding. So swaddling your baby is helpful when you need to supplement. So when do you need to supplement? If your baby is not feeding, so you supplement with your own milk. You don't need to give them anything else. You can remove what milk there is in their breast if they're not latching properly, and give them that either by cup or by spoon. One of the resources that you'll get is a really nice video on how to do that. So use these two tools. If you start to give them bottles, the sucking mechanism and the amount of milk they can get out of a bottle is so different from what a breast works. How a breast works is that they can get used to that fast flow of milk, and then that'll interrupt their abilities to work and remove milk from the breast. And one of the things that's important to know is that your milk is enough if you're able to get some milk out. If you can't express that milk, ask for help from either your health professional or the CLSC nurse, but hopefully earlier than that.
Or you.
Sorry?
Or you.
Yeah. Or the other thing is, if you're having trouble expressing your milk, always know that lactation consultants are really, really, we're very much about promoting preventative care. So if you're concerned that you can't get milk, come and see us. You can come see me before the delivery. You can come to see me afterwards if your baby does not seem to be getting enough. But we'll talk about that in a moment. So sometimes medical conditions require babies to get formula. And so it's important to know and remember the size of your baby's tummy and how much to give them, even if you're using a spoon or a cup. The first day, your baby's tummy is the size of a cherry and they can only tolerate about a teaspoon of milk. So whether it's your milk or it's formula, that's all they need is about a teaspoon on average every 3 hours. The second day, their stomach starts to get a little bit bigger and they need a tablespoon. So these are all kind of images to help you remember that's very little milk. The increase happens over the first week. The 60 milliliters is only 1 week when they need that. They don't need as much as 60 milliliters in that first few days. And this is exactly what the ready to feed bottles contain is 59, 60 milliliters or 2 ounces of milk. So giving your baby formula, if they need to have it in this large amount, can actually lead them to throw it back up and you worry that there's something wrong. It's just that their tummies are overcapacitated. They cannot digest, they cannot process all that milk. So give them just little bits at the beginning, just like you would your own milk. Okay. So remember, the babies go to breast for many, many reasons. And what's important is that in the days after your birth, you need to focus on just getting to know your baby, getting to know the hunger cues. Help from friends can be even as simple as getting informed, sharing this video with your family or friends who want to be there to support you afterwards. That is really, really important for your success. And then looking after, partners can look after mom, family can look after mom. Mom should really just focus on recovering and getting to feed her baby. Knowing where the support is available, so asking people ahead of time to plan to give you help. They can offer encouragement. Just positive words, reassuring words can really, really be important. And encouraging rest, so being there to help you look after baby. And each mom is different. Some moms need more support, some moms don't need as much support, but remember, you're recovering from a very big process, and the more relaxed, the more comfortable you can be, the more chances of better milk production. So knowing what is normal really helps, because then you can really feel confident that things are working. So babies do go to breast for lots and lots of reasons. So it's not always that they're just hungry. Sometimes they just want comfort. They just are programmed to feed frequently so that the milk can come in. Keeping your baby skin to skin and in contact with you can actually lead them to be more confident toddlers, if you can believe it, because it helps to wire their brains to feel the security, the reassurance that they're okay. So then they can actually go forward being more and more secure and attached to you. They don't feed on a schedule. And so often moms and dads are concerned because a baby feeds and wakes during the night. That is programmed for a reason. Their bodies need to eat every 3 hours maximum. So that helps your milk come in. It also helps them to digest that easy milk. Giving them formula instead can affect their sleep to the point where they can be at risk for sudden infant death. So that's one of the risks of giving formula all the time, is that it's an increased risk for sudden infant death. So it's not a bad thing to supplement with formula, but it just is important to know the less, as little as necessary, if it's necessary. Crying is also a normal behavior. Babies cry. They need to communicate with you. So keeping babies close, you'll see what a difference it makes. Babies are calmer. They don't cry as much. And sometimes they need less stimulation. Sometimes they just need to be in a quiet environment. Sometimes they just need their diaper changed because they just don't like having a poopy diaper. So just always look through those things before you think, oh, my baby's still hungry. Look at those little factors. So by holding your baby skin to skin, you're going to help them to learn to breastfeed, and really important, learning to express your milk by hand will be crucial in those first few days. So take it a day at a time. Like I said, take care of mom. Try to go for a walk outside during the nice days. It's really important to get out and get some sunshine. Look at joining a support group before you even deliver, to be able to see moms and babies feeding, even if it's virtually. It helps to see how different moms position their babies and how it works for them. And then if you're concerned, if you have a baby that's born too early, if you're having nipple pain, if you're having damage to your nipples, that is not normal. That is not something that you should let go on. If the baby's not latching, you can keep feeding them by cup, but that's not what you want. You want your baby eventually to come back to breast. And even if you have to give a bottle of formula in those first few days just to make it through, that doesn't mean that it's over. It means that you need to come and see me. You need to we can figure out a plan to get your baby back to your breast, because it's such a huge relationship for you and your baby. It's so worthwhile, and it's not impossible to get back. It's really, really quite easy. We just have to know how to do it the right way. So that's why it's important for you to come and see me. And the way to do that, we have prenataling counsel sessions. We can address all these issues here mentioned. So the best way to do that is to book one of these services. I can come see you at your home. I can come and see you right after, or you can come and see me right after birth if you're more comfortable coming to our clinic. I can have an emergency appointment if things are really, really not going well and you feel like you're about to give up. Give us a call, book an appointment. We can see you within just a few hours if the timing is okay. So we'll at least we'll call you and figure out a plan until I can see you. So the best way to book the services are here at the Kinetex website. So Kinetex Centre de Santé Pelvienne. Click on book an appointment and it'll feed you through to the different choices, or just give us a call, because the receptionists are always available during off hours. We're frequently monitoring the messages that are left. So leave a message, tell them that you need to see somebody urgently, and we will respond to you and we will contact you to make sure that you get the care that you need. Okay, I'm going to unshare my presentation and invite you to ask me any questions that you might have about any subject, but we're looking at another maybe 10-15 minutes of time. So any questions that you might have, I'd be really happy to answer. So just put your hand up or unmute yourself and just go right ahead.
My question is, when is it recommended to start practicing expressing milk? What week of the pregnancy?
So it's important to know
Thank you.
if it's safe for you to do so, you can start practicing anytime after 37 weeks, because that's when your baby is technically term. And to know that practicing hand expression 2 or 3 times a day will not put you into labor. It takes very many stimulations and oxytocin releases to put you in labor. So just getting the hang of that motion is really, really helpful in those first. If you want to be safe, make sure it's after 38 weeks, but 37 weeks is really the time when a baby is fairly well ready to come out, if they're going to come out, and that's a good timing. Does that answer?
Yes, thank you.
If you'd rather type a question into the chat, please feel free.
Are there any food restrictions while breastfeeding? Food that we should avoid or something?
Not at all. Not at all. Anything that you've eaten during pregnancy or even things that you may have been avoiding are now safe to feed, because it's not a direct connection between the bloodstream and your baby's bloodstream. The milk is produced in the glands separately. So any food you eat will be processed by your body, processed by the baby's body before it gets into the bloodstream. So the same goes for medication. But really making sure that you have enough omega-3 is one of the only safe suggestions for supplementation. So making sure you have fish at least once or twice a week, or take supplements, because your baby's brain development does count on the right kinds of fats to be in your diet. Otherwise, everything else is fine to try. If your baby is sensitive to something, that's a process that needs to be examined, and that would be another reason to come and see me. If your baby seems to be reacting to something that you're eating, we can work together to try to eliminate what foods might be problematic. Does that answer your question?
Yes, thanks.
Okay. So should we continue to take our prenatal vitamins? Absolutely. Absolutely. Those are important to ensure that all your minerals and vitamins are at the right levels. And that will help to also support your baby's intake. But your body is usually able to make really high quality milk, even if you weren't able to take prenatal vitamins, even if your body is not necessarily in the best in terms of nutritional. Your body is made to support your baby, so it will make high quality milk no matter what you eat. Any other questions? I don't know if you have questions about breast pumps. I know frequently I get asked this question about using a breast pump to remove milk in the early days. So the colostrum that you get is so sticky and thick that you'll have a really hard time removing it with a plastic hard pump. And that's why I encourage you to use your hands in those first few days with the colostrum. If you need to keep on removing your milk because your baby is not able to drink at the breast, then you may need to have an electric pump. Otherwise, using your hands and then moving on to possibly a hand pump when you want to put some milk away is the best way to go to start with. Somebody just mentioned the haka. So what happens is when your milk volume increases, and you get a letdown reflex when your baby starts to suckle, the hormones released will compress and help the milk flow more easily. That's what's called a letdown reflex. Your other side will often start to leak. So having a haka is actually not, it's not a pump in as much as it's a collection device to make sure you're not losing all that milk that gets released and the milk that's flowing from the other side. You get drops. Some moms get more than drops. If you want to save that as an extra, then absolutely a pump like that. But you could also use a container to catch the milk. So Haka is very, very cool. It's not a necessity. So there are no tools that are necessary until we need to work on problems. But, just you, your baby, and skin to skin contact with some manual expression, if there's any difficulties, is crucial to know that that's all you need in the first few days and sometimes the first few weeks of establishing breastfeeding. Tips for engorgement: frequent feeding. So really, unless you have a baby that's not able to latch to the breast because of engorgement, you really don't need to do anything special. Now, what is engorgement? When your milk does start to be more volume in the 2 to 5 days after birth, then your breasts get full, and sometimes it flattens the nipple and makes it difficult for a baby to grasp a lot of that breast tissue. What you can do is use your hands to squeeze out a little bit of milk to soften that area, and then makes it easier for your baby to grasp and pull that area into the breast. Once they start to drink, that'll help with that engorgement. If you're having difficulty with engorgement and your baby is not removing the milk from your breast, come see me. We have physiotherapists who can help you with breast massage. I can help you with breast massage. So that's a really important reason to come see us, because milk engorgement could mean the baby is having difficulty feeding properly. It could mean that it's not removing the milk properly, and there could be other things going on that need to be addressed. So engorged breast that's not getting better if the baby feeds is a really important sign that something needs to be looked at a little bit more closely. Another question that I saw was storing milk. So if the baby doesn't want it right away in the fridge, even at room temperature, that milk, if it's a clean container that you caught the milk in, is good for 4 hours. In the fridge, you can keep it for 5 days. And then in the freezer, it can be for up to 6 months. So it's really, really important to know that that milk doesn't go bad very quickly. So as long as you store it properly, then that milk will be available for your baby later on. And some moms are able to really supply a lot of milk for their babies, but it takes work to do that extra. I would recommend waiting until your baby's feeding is well established at 4 weeks at least before starting to pump extra milk to have a storage. Because if you over pump in the first weeks, then you may get engorgement. If your baby is feeding well, then let the baby's needs regulate how much milk you produce. Because if you overstimulate and overproduce, then you can lead engorgement. You can end up with engorgement, and then you can get problems like blocked ducts or mastitis. We don't want it to go that far. So as I said earlier, if you have engorgement and you can't seem to it doesn't seem to be relieved by the baby feeding or even using a pump or using your hands, that's an emergency, and that needs to be seen, because we don't want that breast to become infected. Don't wait that long. Come and see me sooner. Other questions? Well, it's just over an hour. If there are no questions, then thank you so much for joining me. It's such a pleasure to be able to inform parents ahead of time what they can do to succeed at breastfeeding. You will get a copy of a recording of this presentation, as well as resources that you can look for more information. And if you have specific questions, concerns, please don't hesitate to book an appointment with me. Even in the first few weeks, if you just want to make sure that your baby is feeding well and you want to just reassure yourself, don't hesitate. Come see me and we'll reassure you that your baby is doing well.
They can book now as well, right?
You can book ahead now if you know when your baby is due, but if you want to wait until the baby is born, then that can also work, because sometimes you just don't know when your baby's going to be born, and you don't know if there's going to be problems. Sometimes it goes really well. Sometimes it does take a while to figure it out for both you and baby. So give yourself lots of time and patience, and make sure you get lots of good help before you give up. So if there's no further questions, then I thank you again, and I wish you a really good day. Stay cool, stay hydrated, and we'll hopefully see you in the next few weeks or months. Bye, everybody.